to create that bit of extra space there, and then you could work right in at the top of the shoulder there, or you can choose and bring it around here. Now again, we've tightened up the muscle, right? If you want to have that muscle loose and go in a bit deeper, bring it round at the side and then use your thumb to work into it, right? So you can use a picking up technique if it's here. If it feels clumsy, bring it round the front and use it as circular thumbs, digital thumbs. And again, your techniques for the forearms is at the wrist. Work on the wrist bone, give it a bit of flexion. You can do your crisscrosses. And you've got medial to lateral. Okay, so again, you've got 3 strips that come up there. You can work those strips as a whole, or you can work 1, 2, and 3. Right, squeeze the hand, and again, flick it out. Now, that's what you need to do for your arms and your shoulder. You want to then drain it out the neck. So we have a picking up, we have a kneading. See how he's got all the goosebumps there? See how it's moved? See all that? Yeah. Right. So we have a picking up, we have a kneading. So important, don't ignore those 5 points. That's a good.
I was doing that so much yesterday.
You were doing it a lot?
Yeah, when Tim was doing my feet, I was just like that yesterday. I was like, oh, you go too far.
That's like rolling your knuckles as you do it.
Yeah, this is double knuckles.
Right. Yeah.
That's it, good. I'm not going to do that one. Sorry, I was doing another technique there. That's not for this course. It's really difficult. See, the more you go on, you have to go, right, that's full body, that's Thai, that's deep tissue, that's acupressure. And it's difficult to not do it when you're used to working with them. Like Tonya's got such a beautiful style. I've had a massage from Tonya, and she's really Thai massage. You should see her working those meridian lines. And when you meet another therapist and you know what they're doing, you have like such respect for them. You're like, oh, it's amazing.
Do you need any students today? Did you need any students today?
Tonya had me crying at my house a couple of weeks ago.
Really?
Yeah, she did. She really she really knows how to move energy in the body. She's beautiful. Yeah. Okay, so that's us finished. Now, I'm going to show you something else, just to throw you in even further. Right, Carol, turn over for me, please.
Make sure you get this one. Hello.
Head up, right up at the top above the hole. Always have your client with their head above the hole, because it's too much when you're working with if they're far too down the bed. It will put too much pressure on your neck and shoulders. Again, watch your own body mechanics. Right. Now, say for instance, when you were doing your session, you had a specific client come in, you ended up doing an awful lot of work on the back and on the shoulder, but the client was saying, not only is my shoulder sore around the back there, but it's holding around the front. Okay, what you would want to do is work into these pecs here and then take it down the arm and out the hand, right? So remember yesterday when we were doing our upper body work, and we were also doing, what's the technique that we use across the chest?
Effleurage.
We use effleurage.
Knuckling.
What else? After we do effleurage?
Knuckling, gliding,
Yeah,
knuckling.
double knuckles.
That's it.
Okay, so if there's a problem at the front of the shoulder, if it's tight, yep. So you warm up with your effleurage. How many times? Roughly 6 to 8. However, to get in a little bit deeper with the pec tissue here, right, you want to come in and give it a bit of double thumbs.
Yeah.
So people who have anxiety, this can feel great for them as well. Okay, and then after you've double thumbed it, okay, you then want to just push that shoulder down a bit, really open up the joint, bring it around, and then focus on your side effleurage there. Okay, now leave the head at the side, right? Bring the arm down. And again, if you've not worked the arm when he's been down, you can work the arm now. So it's exactly the same. You want to do some flexion here in the wrist. Do your crisscrosses in the wrist or some circles. And again, you're coming up on your 3 points. You can come right up in the center and you're working mid to lateral. Again, the arm's not up here, it's down here. And you can also use your crisscrosses as well. As we transition, you can use your pêche dressage, but his forearm is so tiny, I wouldn't transition, but you can do. If you've maybe got Reese's arms, you could use a bit of kneading on there, but I'll just come up with a bit of effleurage, okay? And then certainly as we come in here, you can use a bit of kneading on his arm. Now, when you get into do more advanced courses, if you come back, right, you can also work the arm in this way as well. And then you would bring it back, and then you would also strip into it in that way, right? There's loads of things that you can also do. Deep breath. And out. See, after you release the muscle, then you can do some assisted stretching. You would do all this in your deep tissue splutes if you're interested to go in deeper. That's how you do it, okay? Deep breath. And out, and on the out breath, you then lift. And then those of you that have seen me work and see how I work with towels as well, you then come in and take it all out of the finger joints. But in this case, you would use, there we go, your own fingers just to. That's nice, yeah, good, well done, Carlo. Okay. So that's how you work with it up. Okay, right, okay, that.